This is Hawaii MD TV with Dr. Akita Raman Pereira.
Aloha, welcome to Hawaii MD TV.
How often should you have a medical checkup?
The seniors should have a general checkup every year, once a year. It includes by your healthcare provider, your physician or nurse practitioner, head to toe physical exam, the eye exam and the ear exam, the throat exam, the lungs, abdomen, and the lower extremities. If the person is diabetic, they do a exam to see if you have sensation, if your sensation is intact. It also includes doing the blood test, the basic blood test, which is fasting blood glucose, cholesterol profile, urinalysis. If you are taking the medication, your doctor may also do electrolytes and liver function test. And the other tests which are very important in women when they become of certain age, to do a mammogram and a pelvic exam, because the pelvic cancer and mammogram, they are preventable, and if you diagnose these cancer by doing an earlier mammogram and rectal exam and the colonoscopy, you can prevent the cancer, or you can cure the cancer to start with. In men, one should have a rectal exam and the colonoscopy, as I said, for the women also. So the rectal cancer is also preventable, and if you diagnose early, it's curable. So the other test which is very commonly missed is the bone densitometry, mean to check for osteoporosis, especially in elderly, because osteoporosis is the thinning of the bone, and before thinning there are signs that the person is going towards osteoporosis, and those when the person has osteoporosis, they can have fracture of the bones very easily, because the bones are very brittle, and if a person is diagnosed with the osteoporosis, they can be treated to make it better.
What's the most important health issue?
There are many health care issues nowadays. All of them deserve more attention than they are being given. As I mentioned before, that we spend $4 trillion with T on our health care. And you would expect that we will be the number one healthcare system in the world, but we are not. In spite of spending $4 trillion, we are way behind other developed countries who spend much less money than we do. So many healthcare issues exist, such as access to healthcare. There are still a lot of people who don't have insurance or don't have access to healthcare, homelessness, and mental disease. But the most important health issue right now, is people are unable to get their medications, even if they have been using those medications for a long time. They can't even get generic. The reason is that private insurances are requiring prior approval for these medications, which is totally wrong. Getting the prior approval of a medication takes a lot of time, and I have experienced that even after filling a long form, the medication is denied, and it affects the people's health, their disease, and it costs more money to our society when there is a complication of the disease.
How much water should you drink every day?
Water is so important to our body. 1 gallon of water per day. 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 1 g more than 90% of our bodies are actually made of water. So we need to replenish that. And I'm not talking about replenishing with the liquid, not with the Coca-Cola or Pepsi or wine. No, none of those. Pure water. And there's plenty pure water in Hawaii where we live. We are blessed with the fountain waters and the purified water from the sea, deep sea water. We have all kind of water. So water needs to be replenished. Same amount of water which you excrete in the urination, about 1200 cc, 1 liter 200 cc, which will be like two bottles, small bottles, 500 cc bottles, and a little bit more. Or if you are eating the curry, then there's water in that too. So you can just drink 2 water at least per day. Now, people drink a lot of water sometimes. I have patients who came to me and they're drinking 6, 7 bottles of water and they're happy. I say, no, don't do that, because I had patients admitted in the hospital who had water intoxication. That means there was so much water in their body that their electrolyte sodium became very low. Normal sodium should be like 134, 135. Their sodium was like 120. And that makes people weak, and they can have arrhythmias like irregular heartbeat. They can have a stroke from the irregular heartbeat. They can have a heart attack. So when somebody comes with a hyponatremia due to water intoxication, psychogenic hyponatremia, which is due to drinking excessive water, so be careful. My grandmother used to tell me, you can do everything, but you have to do it in moderation. So moderation is the key. Okay? Actually, diabetes is a disease which has no signs. It has absolutely no sign. Patient can have full-blown diabetes and have no symptoms or sign at all. But if there are signs, if the person is lucky, there may be some signs like drinking a lot of water, polydipsia, peeing a lot, polyuria, and eating a lot, polyphagia. And they may have blurry vision, frequent infections, there are many other problems which are non-specific. So the best thing is to have a annual blood check every year. And especially the people who have family history of diabetes or high blood pressure or obesity or hypercholesterolemia, because all these diseases coexist with diabetes. In my opinion, there are a lot of people in America or worldwide who are diabetic and just walking around with the disease. So my opinion is that everyone, regardless of the age or the family history, they should have a check for diabetes. Diabetes test is you fast for 10 to 12 hours. I mean, when you sleep, after your dinner, you don't eat anything for 10 to 12 hours, and early in the morning, you go and do the blood test. It's called fasting blood glucose, which is the simplest test. And if blood glucose is more than 125 on 2 or more occasions, then the person has diabetes.
Are there any foods that you should avoid?
Most of the food which have sugar inside, they should be, you don't have to avoid it, but you have to put a limit on eating those fruit. For example, fruits have a lot of sugar. So your quota as a diabetic is 1 apple per day, or equivalent to 1 apple per day, which is 1 banana, 4 strawberries, 8 cherries, quarter papaya, 1 or 2 slices of pineapple, like that, per day, and a small juice, small glass of juice per day. And then cookies, candies, all these things which have sugar inside should be avoided. I mean, should be a limit on those.
What preventive measures can individuals take to reduce the risk of heart disease?
There are four important things which a person must do to prevent the heart disease. Actually, any disease like high blood pressure and diabetes. The first one is the body, mind, and soul. It's a combination of all three which needs to be healthy. What I mean is that you have to have a positive mind. A positive mind is a healthy mind. Then you have to have a positive, loving heart and soul. And the third thing is the body. It's important to take care of the body. And how you take care of the body is by doing a regular exercise. Means that you walk 30 minutes, brisk walk 30 minutes a day, or 15 minutes of running. And it should be regularly, every day. And then also healthy food means that eating more vegetables like broccoli, tomatoes, potatoes, there are a lot of vegetables. Lentils are good. Also avoiding the fatty food such as meat with skin, chicken with skin, pork has very high cholesterol, egg yolk has very high cholesterol. So eat chicken without skin, turkey without skin, and egg white, and avoid the pork, or don't eat pork too much. The other thing is the fourth thing is the water. We must drink water, same amount of water we should drink, which we pee out, like about 1200 cc of water approximately, and the rest come in food. And I'm talking about the pure water. I'm not talking about the Coke or the wine or the tea or the coffee. Pure water, and Hawaii has a lot of pure water. We are blessed.
Do insurance companies make promises they don't keep?
Cover you for all the diseases you have. What they say, it will cover you. It will cover you for diabetes, high blood pressure, stroke. When you are admitted in the hospital, they will pay for it. Now the health insurance company, they will make all kind of excuses not to pay. They will investigate the claims. They will not pay. It's called a clean claim. Medicare has a clean claim. You bill them properly, they will pay you, but not with the insurance company. They won't pay you. They'll make it very difficult for you to get the payment for the service you provide. This is the finding of not me personally. It is the finding of University of Georgia, business school.
What makes a hospital successful?
If a hospital wants to be successful, they have to be unique. They have to give a unique service and be so good at it that they will survive. If they are going to compete with each other, they will be the jack of all trades and will all fail, which happened few years ago. Queen is known for a trauma center. All the traumas come to Queen. Imagine if the other hospitals start competing with the trauma, Queen will get less patient in trauma, and they will start doing the other hospitals are doing, and they both will fail. Like Anderson Cancer Institute, they are very good in cancer. They have monopoly in the cancer. So everybody goes to them. Everybody refers to them. They don't do heart attacks, right? So in this age, it's better to be very good at, and provide the best service to the patient of what you are good at. Be good of what you are good at it, and provide that service to the best of your abilities. rather than competing with each other. So every hospital can be good at something they do best.